This is an interactive business event and conversation focusing on developing and communicating the business continuity plan. I'd like to thank you for joining us. My name is Bo Burch, and I will be your host and facilitator. Please send your questions and comments by way of the chat portal. We also have a dedicated email, if you'll note, working remotely at humancs.com if you wish to send an email with comments and questions. Our firm is Human Capital Solutions, and we will have representatives available to respond. And there will be some time at the end of the session for Q&A. Be sure to follow our LinkedIn page at Human Capital Solutions for updates regarding human capital matters and other matters. Our next scheduled event will be next Thursday, June the 18th, with Mr. Brian Tuttle. Brian is the CFO of a company called American Materials Company. He'll be our guest speaker. And next segment is about essential workers in the construction space, how they particularly had to embrace to handle the COVID-19 crisis. We're very fortunate today to have my new friend, I'd like to say, Mike Rood. Mike is going to have a conversation with us entitled Pandemic Response and Home Infusion Healthcare Services. Our theme for many weeks now continues to be developing, communicating the business continuity plan. Many companies are still somewhere in the execution of that plan, and many are now building and communicating return to work policies, protocols, so it's ever changing. Thank you, Mike, for being with us.
Oh, it's a pleasure to be here. I appreciate you having me.
Yeah, thank you, sir. Mike is a seasoned global human resource executive. He's a business partner, and he's been in this line of work for about 30 years. He has demonstrated significant results in developing and implementing strategies that attract and engage and grow a world-class company. Mike has extensive experience with the life science community and industries, transforming organizational cultures and optimizing human resource systems and functions. Mike joined Option Care Health, which is based in Bannockburn, Illinois, a suburb of Chicago, in 2015 as their Chief Human Resource Officer. In this capacity, Mike is responsible for all human resource and communication activities for a $3 billion, 6,000 employee home and alternative site infusion services company. Mike led and supported the company's separation from Walgreens in 2015 and established the new HR function. As a member of the steering committee, Mike led the organization People and Culture Integration of 2019 BioScript acquisition. Prior to joining Option Care, Mike was the CHRO for Catamaran Pharmacy Benefit Management. Also, prior to that, CHRO for Stryker Corporation, which is a 22,000 employee company located in 100 countries. Today, Mike's going to share with us what he's learning with Option Care Health. He and his family live in Chicagoland. And welcome again, Mike. I'd like to start, if we may, to tell us about Option Care Health. Perhaps it's not a household word. Many of us maybe have not heard about Option Care Health and what you guys particularly do, Mike.
Sure. Thanks, Bo. I appreciate it. Yeah. So Option Care Health, we've actually been around for about 40 years in various different forms. Our primary focus, we're the largest independent home and alternative site infusion services company. So what we do is we provide a range of intravenous treatments to people with serious chronic and acute disorders. It ranges from things like anti-infectives, nutrition support, heart failure, chronic inflammatory disease, bleeding disorders, neurological disorders, and the like. But the primary focus is that the care is provided in alternative sites. Most of the care is happening in patients' homes or in what we call our alternative treatment centers that are part of our locations. So part of our responsibility is to help transition patients out of the hospital into a more conducive setting And I think, Bo, you're probably seeing it in healthcare as well. More and more healthcare is going to alternative sites, moving people out of hospitals and ultimately into the home setting. But said, we've been around for 40 years. We were a separate company. Walgreens owned us then for about 7 years. And then in 2015, private equity acquired the organization. And then last year, we merged with one of our competitors, BioScript, and now have become the largest independent infusion company, public company. We treat over 220,000 patients a year. We've got almost 3,000 clinical professionals, nurses, pharmacists, dietitians, pharm techs that really are the kind of the lifeblood that provides care to our patients.
Excellent. Wow. So, Mike, how's the pandemic impacted your business? I'm sure it has. And how have you provide services to your patients through this crisis?
Yeah, it sure has, Bo. And just as it's affected, I think, most healthcare related companies. And we've seen impact across both of our sides of our business, our acute and our chronic side. As you can imagine, with the pandemic, fewer people are actually going into having, for example, elective procedures. And so a small portion of our business is tied to therapies that are associated with elective procedures. So as people are putting those off, we're seeing fewer of those patients. We're also seeing as hospitals really geared up to handle the pandemic, really helping to move patients, non-COVID related patients out of their hospitals, and focusing on that part of the business. We saw again with some acute business a bit of a dip there. Now the fortunate thing is hospitals are opening up again. Some more of the elective procedures are happening. But we also did see with our chronic patients, these are the patients that have long-term disorders and require long-term treatment. We saw some people going to their physician less with that, again, just out of concern for the pandemic. So we saw a little bit of a dip there, but again, we're starting to see that business come back. We obviously also incurred additional costs, as a lot of other companies did, as we had to scurry quickly to acquire and procure a lot of PPE for our caregivers as well as our organization there. But I will also tell you, Bo, it's really challenged us in some productive ways to think about how we need to do business differently, leveraging technology and the like, and be glad to talk more about that. But you know, we obviously did see some impact, and we'll have to see, particularly if we feel a second wave is coming up here in the future.
Thank you, Mike. And essential workers and caregivers are truly on the front line. We have a highly contagious respiratory illness. What steps have you taken to protect both the caregivers and the patients you serve, Mike?
Great question, and it's first and foremost to what we are thinking about as well. So one of the things we did, Bo, from the start, we established a command center very quickly with all the key leaders across the organization so that we could respond quickly and make decisions across the organizations on a whole host of things. We meet twice a week to talk about it. As I mentioned, we had to very quickly procure PPE for all of our, particularly our patient-facing, our caregivers, our nurses, our dietitians that are interacting with patients. And not only did we have to make sure that they had the appropriate PPE, that we also had to make sure our patients and their family members that are typically around during a treatment session also were effectively protected. And so making sure that our caregivers and nurses had the right equipment. And some of those therapies, Bo, last for hours, up to 6 to 8 hours. So being comfortable and making sure that we had the right equipment was key for them. And again, in the workplace, we're clearly making sure everybody is masked and wearing masks. We're taking steps around social distancing and figuring out how we need to configure our workspaces for that. And one of the ways in which we're keeping people safe is, as I mentioned, leveraging technology so that we can virtually educate, train, transfer patients, where before we would normally do that person to person. And so as we transmit and transfer people out of hospitals using technology similar to what we're doing right now to help educate them.
Excellent. So Mike, how have you and the leadership team modified the workplace? You have a dynamic workplace. It's from the hospital, it's to the home, it's some of the care centers. And how have your employees responded in doing their job safely and effectively?
Well, we have several different types of employees. So part of our core part of our business is to compound these drugs that we're providing for our patients. So there is a meaningful number of our employees who need to go into the office, and they're working in a clean room pharmacy setting there. Now, the good news for those employees is the normal procedures in a clean room where you're compounding drugs actually provides a very safe environment, particularly related to the pandemic. But there are other people that have to go into the office as well, our shipping and delivery folks. And again, that's where we're making sure that we have appropriate social distancing, people are wearing masks, and the like. We've also gone significantly towards enabling a remote work or a work from home workforce. Prior to COVID, we had about 40% of our employees who were remote enabled. Within 4 weeks after the pandemic, that number went up to over 70% of our workforce is now remote enabled. And we've seen some nice productivity gains out of areas like our billing centers and the like. So we've made a significant shift to working remote. And for those people that do need to come into the facility, we've been very clear about appropriate protocols around safety, social distancing, masks, and the like.
So Mike, it sounds like a lot of quality assurance changes and safety changes. Do you project, Mike, that many of these changes may very well remain in place after the pandemic passes?
Bo, I really do. I think that the good thing is that for those people who are not required to go into the office, particularly those in our pharmacies, work has gone well. And in fact, one example with our 700-person billing centers throughout the United States, we've gone almost 100% remote for that group. We've actually seen an uptick in productivity from that group. Feedback we get from employee pulse surveys say that a majority of them really enjoy the work from home. We still have people who don't want to work 100% from home. So I really believe that much of the remote work is gonna stay in place as we go forward. The other thing that we are sensitive to is that each state's board of pharmacies have various regulations, and through this pandemic, they've loosened up and become more flexible in some of their requirements on that. So we may have to adapt as states potentially tighten those regulations back up. But I think the new normal going forward will not look anything like it did pre-COVID.
Mike, there's a tremendous amount of change with frontline caregivers, and then there's the managerial, the supervisors. How have you guys best equipped your managers to handle with this pandemic?
Yeah, good question, Bo. And it's making sure that the frontline managers have all the information they need is critical, because at the end of the day, they're the ones who are actually doing the day in and day out work and managing folks. So there's a couple of things that we've done to better equip them. As I mentioned, we started this command center. We meet twice a week. That's really so that we can make decisions and disseminate information quickly to those people. We established a company hotline so that anybody could call the hotline, and it was serviced with key decision makers across the key clinical and other functions, so that anybody could call in, ask a question, and get some advice on that. We developed and deployed what we called situational guidelines. So we worked through all the various types of scenarios that may happen as employees come into the workplace, whether they are exposed, whether there's a positive test for COVID or not, all the people traveling, coming back from cruises, things like that. So all these different situations, we developed very specific actions and guidelines for how these local managers needed to handle that. We established the social distancing and the cleaning protocols that have to happen within each of the facilities. And we had regular updates. The executives from the different functions had weekly updates with their leaders. And I think the other thing that we did is we deployed a new communication app across the organization that allowed managers to communicate with their teams very quickly in a very focused way, but it also allowed us from a company perspective to provide more broadcast communications and do that quickly, whether it's video, whether it's text messaging, we were able to do that. So again, a lot of tools, information into the manager's hands as quickly as possible.
Great, excellent, Mike. Thank you for sharing that. And so now we've moved through a phase, whatever phase of the pandemic that we've moved through. There's lessons learned, of course. What would you want to share with colleagues out in the audience? Some real lessons learned, Mike, from experiencing this.
Yeah, I think there's a couple. I do think that command center that we set up early on was pivotal because, as everybody knows, the situation is changing almost on a weekly basis. Direction from the CDC varies, direction from the states vary, different situations come up like that. And so our command center brought together all the key people from all the different functions twice a week so that we could very quickly discuss critical issues, have discussions, make decisions, and move on from there. And so getting those people together, and we're still doing that. This morning was one of our calls as well. So that command center where you're constantly talking about issues, I think that was key. I also think setting up the hotline was very important. It allowed all our employees anywhere to ask questions, get information, share with us whether they had been exposed, because we are tracking every single employee's exposure and who needs to quarantine, who may have tested positive and the like. So we're tracking all of that. I think as much as you can, make it very clear to your frontline managers what to do in what situation. So that our situational guidelines, the communication that we provided, we had weekly updates, weekly COVID updates to begin with. We've now moved past the weekly time frame. Usually it's about every other week to provide some updates. So communication obviously is key. And then what we found, particularly as people are coming into the workplace, the local managers need to be involved in the decision-making around how to best staff the groups, how to figure out social distancing, because each of our locations is a different size building, different dynamic, different setup. And so needing to make sure that we tapped into those local managers to figure out how to best apply the safety protocols in their location was critical. That wasn't something that you could just dictate from corporate and make sure that it was handled effectively.
Excellent, Mike. Very, very well, thoroughly stated. This is an area of healthcare I'm not sure a lot of folks have thought about. We think about hospitals, we think about urgent care, we think about the going to the dentist, physical therapy, but in home, we really shared a lot. Reminding the audience that we have the chat portal available and we have working remotely at humancs.com email, and would like to open it up. There's a question coming in. Mike, can you see the question?
I can, yes. Any new best-in-class practices through the crisis? Well, I do think the one thing I think that we feel is best practice. What were those situational guidelines? In fact, I've shared those with a lot of other of my colleagues across the organizations to really, and it listed out all the different types of scenarios that we've come across and provided the very specific action steps that we needed local managers to take. So I think equipping them with those very specific actions has been critical for us to be as effective as we have been. That'd be one of the things I'd mention.
Mm-hmm. And another question coming in.
Yeah, so how do we feel our company's culture has changed positively or negatively through this? Great question. I think I'll give you, I guess, both sides of that. I think from a positive side, and I think one of the things that actually surprised us was how quickly we could move people to remote and to be capable to work remotely, and how effective that's gone, and the positive feedback that we're getting from our employees. Again, as I mentioned, we've surveyed our employees who are now working remotely, and the majority of them do not want to work 100% from home, but the flexibility to work 1 or 2 days maybe in the office and the rest of the week at home has been a very big upside. And again, we have not lost any productivity. So I think that's going to be part of the new normal for Option Care Health as we think about those people who don't necessarily have to go into the office. I think culturally, though, what has also challenged us in that work from remote working is making sure managers are connecting on a more frequent basis with their employees. And so our advice to our managers who are have teams working remotely, you need to be talking to each team member on a weekly basis, even if it's just to catch up with them, how things are going, with them and their families. It's important that they catch up and they stay connected with their managers. I think long term, I think it's still yet to be seen how companies like Option Care Health and others are going to have to adapt culturally if they have a majority of their teams working remotely. Great question.
Couple more have come in.
Yeah, let me see. Did the empowerment of the local middle managers lead to higher engagement per the surveys? And did this increase engagement? Yeah, great question on engagement. We are seeing that the individuals, and engagement with the individuals has gone up. I think we've actually yet to formally survey the broader organization since we've gone live, since the COVID pandemic. But what I can tell you is the amount of regular communication that we provided out to those caregivers, those almost 3,000 clinical folks, the feedback we received from them has been outstanding. They felt very informed. They felt that they had up-to-date information. And as the CDC or local boards of pharmacy changed their requirements, we were able to get that out very quickly to them. So the anecdotal feedback that we're getting from folks, particularly around the communication, as well as this new communication app that we deployed, we've received some really strong feedback from that. So we'll be doing actually in early September another one of our formal engagement surveys. So I think we'll get a better chance to see the actual true impact from an engagement perspective. Couple other questions. The app idea. Were there any issues with using the app? I'll be honest with you. Nowadays it was a very intuitive tool to use. We piloted this in our revenue cycle team that went remote quickly. And after such a very positive pilot, we decided to go big bang release with the rest of the organization. It was so intuitive. The tool's called Bonfire. I don't intend this to be a commercial for them, but the Bonfire communication app. And within 2 weeks, we've had 80% of the organization up and using it, and really there have been no issues at all. Once we secured and communicated what's appropriate and not inappropriate to share, but it's really been a non-issue, and it's been a great tool to communicate across the organization. Let's see, here's another one. How were the key individuals, the hotline responders selected? Was it regionally based or based on functional units nationwide? So it was a nationwide hotline. And we staffed the hotline with senior leaders, with primarily our clinical nursing vice president. One of my senior HR business partners was on there. We also had folks from the pharmacy as well as operations, because the majority of the hotline calls were coming in from the field and questions specifically about what should we do in this particular situation, either from a clinical perspective or an employee perspective. So it has been the same group of people throughout. And I think that's also been important so that there's consistency in the decisions, the consistency in the messaging. We have had to make sure everybody's got a backup, because these folks, while it wasn't 24/7, they were responding to hotline messages well into the evening and early morning. So they were staying up to date on that. So great group of people, and we're also going to be recognizing those people later in the year for all their great efforts. Let's see, there's one other question here, Bo. What workforce capability gaps surfaced during COVID, if any, that you're now addressing, and how have those gaps informed your go forward talent selection and development planning? So that's from Ken. Ken, great question. I think one of the capability gaps that surfaced early on, particularly with remote work, was making sure that we had good metrics so that we could stay on top of the work that needed to happen, particularly in our call center, billing center. So we were lucky that we were able to rally our IT organizations to build out the appropriate metrics so that managers who are managing remote teams still had all the good data that they needed to effectively manage their team. I would tell you, we don't have that level of sophistication across all our functions, and that's why I think it's critical that our managers are communicating with each other on a frequent basis. I will also tell you, Ken, that another gap or things that we've had to quickly modify is how do we skill up our remote managers to manage remotely? Many people have not done that before. How do we make sure that we get the work done, yet also set appropriate boundaries and guidelines for folks? Because when you have all these people working from home, it's real easy to never shut it off. And so we've had to help our managers on how to better have team meetings, how to better connect with their folks working remotely. And so that's something we're continuing to ramp up and to expand our offering on how we skill up and train managers to work remotely. Now, Sheila asked, are we finding PPE shortages now? Actually, we're not. We're fortunate. And hats off to our procurement group that we were working on this in the very early days. Prices have gone up a little bit, to be very candid with you on this, but we are not finding that we are running into shortages for PPE. We're able to equip all our caregivers, all our nurses, dietitians, folks interacting with our patients with the appropriate PPE. We provide cloth masks to all of our office-based employees that are coming into the office. So knock on wood, we're not having issues with PPE right now.
Mike, this is probably more of your medical review officer or your scientific officer, but I think it's fascinating as we see maybe a vaccine is certainly down the road, but therapeutic drugs are going to be coming online. You know, when we look at the work of Regeneron and Moderna, even Eli Lilly.
Yep.
What do you think? I think antibody cocktails and the delivery systems, we know vaccines, how they deliver it, it's not your market. But perhaps there's business coming your way with infusion therapy, with therapeutics. What do you know about that?
Well, actually, we are heavily involved and we're constantly in communication with our biotech manufacturing partners as those firms are thinking differently about how their therapies can be administered. And as more and more care is going to the home, I think more companies and more manufacturers are looking for alternative ways to deliver that. So we have a pretty extensive business development group that's scouring all the various different therapies within the field of therapies that we are working with. So case by case basis on how that plays out. And there have been some more recent specialty drugs that we've been fortunate to be one of the few sole providers for in delivering those through alternative measures. So I think, Bo, you're spot on, though. This is a whole area within healthcare that's going to take off and I think really challenge some of the traditional ways in which those therapies have been provided. And I'm hopeful that that home infusion is going to be one of those key channels in which it gets delivered.
Yeah, that is exciting. I know for many people today, going into the hospital or going even to a pharmacy, we are thinking that that's where sick people are. So
Right.
Having caregivers come into the home certainly gets people feeling more comfortable about that, right?
Well, and yes, and the quality of care and the response, and candidly, the cost to deliver care at the home are all contributors to why we think that's a direction that people are going to would prefer. You know, if you have a 3-hour infusion service, would you rather be sitting in a doctor's office doing that, or would you rather be sitting in your living room watching TV or conversing with your children or other family members while you do that? And so I think that's going to be a clear direction.
Fantastic.
There's another question here, Bo, from Lindsay, saying, with more seeking alternative locations, do we think we'll have a larger workforce? I'm wondering, Lindsay, I wonder if you're asking if we're going to be expanding or growing as an organization, and will this innovate training approaches? So I do think clearly as home healthcare and alternative treatments to healthcare expand, yes, and we are hiring, you know, there are never enough infusion nurses out today right now, and that's candidly a worry that a lot of home healthcare providers have, is just the number of qualified and trained nurses that are coming into the field with that. It is driving very innovative training practices. Again, one of the things that we've deployed now is using virtual technology. So similar to either Zoom meetings or WebExes and the like, to train and educate patients who are leaving the hospital going home. So we can teach them about how to set up their pumps. We can teach them about the appropriate practices that they need to look at and the routines that they need to follow as they help with their own services and their own therapies. So I think this telemedicine is going to become even a more dominant approach to how patients are seeking care, but also how companies like us are going to be interacting not only with the customers in the hospitals, but actually with the patients and their families in how they do that. A lot of other companies in different types of medical areas can, you know, monitor remotely. So you have heart pacemakers that can be monitored remotely. I think that will also be something in our world as we look at the different biometric screenings and tests that we do with our patients, that remote practices like that are going to be something we're going to see in the future as well. Fascinating world we live in. It is.
Great. Lots of questions, lots of participation. Yeah. Great series, great conversation. Is there anything in closing someone has before we thank Mike and the team that's put this together? Mike, you've invested quite a bit of time with us in planning the preparation. We look forward to talking more with you.
Enjoyed it. I really appreciate it. Some great questions from the people participating as well. It's been very enjoyable.
Yes, likewise too. I want to thank the team for putting this together. Thank each of you for tuning in today. Our recorded version should be out tomorrow around noon. And be safe out there, be well, and God bless.
Thank you. Take care, everybody. Thanks, Bo.